Good afternoon, everybody. I'm joined by Professor John Skerritt, the Head of the Therapeutic Goods Administration. Very briefly, we want to give an update on a number of elements today. Cases and significantly and sadly the loss of one life of an elderly 80-year-old gentleman in Queensland to COVID who had been in hotel quarantine, having likely acquired the condition overseas but was treated in Queensland and sadly was the first case that Australia has had of an active life with COVID lost since the 19th of October 2020. In late December there was a historic case which was identified. So very briefly, there are 0 cases of community transmission in Australia today and over 623,000 worldwide, and there have been 8,530 lives lost, but sadly one of those lives lost, as I say, is an Australian life. The details that we have, and Queensland Health will provide consistent with the wishes of the family, anything else, is that this case was an Australian citizen who had returned from overseas, an 80-year-old male, tested positive on day 5 in hotel quarantine and was transferred to the Prince Charles Hospital on the 25th of March. And as the case was diagnosed in Australia, it is appropriately recorded as an Australian life lost, making that the 910th life lost in Australia. And whilst globally now we see that we are approaching 3 million lives lost, each life lost is to be mourned. Each life lost is a reminder of the global challenge, where an average of over 500,000 cases a day in this year across the world, with 63 days of no cases here, reminds us of the extraordinary difference between Australia and overseas. But it also reminds us that there is a global pandemic which continues to rage around the world, with cases having increased significantly in the last month after having reduced significantly since mid-January. This disease finds a way of coming back. Against that background, I would note in particular that Professor Skerritt is here and he'll address a second case which we believe has now been confirmed of thrombosis, potentially linked with the AstraZeneca vaccine. I'll let Professor Skerritt deal with that in a moment. In terms of vaccines, there have been 56,379 vaccines in the last 24 hours. Given that some state programs have been paused or varied, we are particularly pleased about that. That makes a national total of 1,234,681 vaccines administered and 577,000 approximately through the states, with 16,000 in the last 24 hours, and 656,000 through the Commonwealth, with 40,000 delivered across primary care and aged care in the last 24 hours. The aged care doses, we now have 1,152 facilities that have had first doses and another 555 that have had second doses. The other thing that I want to mention is that work is continuing very strongly with the states and with the primary care sector with regards to updating plans following the advice of the Therapeutic Goods Administration and the Australian Technical Advisory Group on Immunisation. What continues? The vaccination program for the over 50s. That remains, as we know, as vital as ever. Vaccinations save lives. Vaccinations protect lives. Vaccinations are a fundamental part of the capacity for each individual to protect themselves, but also to play their part in protecting everyone else in Australia. And today's news just simply reinforces that. In terms of the work with the states and the government's response to what's the advice of the Australian Technical Advisory Group on Immunisation, obviously we're working now with regards to the under 50s and variations that we flagged last Friday. That includes, of course, in particular, the immediate acquisition of an additional 20 million Pfizer vaccines. I met last Thursday evening with the health ministers. I will be meeting with health ministers tomorrow. And in the meantime, we've already held one workshop with states and territories last week. And there is a meeting of today, the Vaccines Principals Committee between Commonwealth and states. Tomorrow, the vaccine senior officials are meeting, and then on Thursday, health CEOs. So all of that is about making sure that we are preparing options for under 50s. So the plan is clear, but in that respect, it's also being addressed and updated to deal with the particular needs of the under 50s. But for the central part of phase 1B, which is the over 70s and 80s, and for the central part of phase 2A, the over 50s and 60s, that remains at its core, continuing in that same manner and process. And at the same time, we're working with the states on making sure that the plan is adapted to deal with the medical advice, as we've always done, for the under 50s.